So integrative oncology is the use of evidence-based and evidence-informed complementary therapies, lifestyle changes, mind-body therapies in conjunction with holistic medical care to improve the quality of life and symptom management of people with cancer from the time of diagnosis through disease-modifying treatment and into survivorship and advanced disease. So it's a part of holistic supportive care, which is how we best manage people throughout from the time of diagnosis on. People may have heard of the term integrative medicine. Integrative medicine is really the umbrella term for the use of integrative therapies, of complementary therapies and evidence-based therapies for all diseases. And so integrative oncology is just focusing on what therapies really suit the person with cancer and to meet the specific needs of a cancer patient. So people hear a lot about complementary medicine, about alternative medicine. The term that we use nowadays is complementary and integrative medicine, rather than a term that many people may have heard of, which is CAM, complementary and alternative medicine. When we talk about complementary medicine, we talk about evidence-based therapies that are both ingested, invasive therapies or non-invasive therapies that can be used alongside of conventional therapy to improve outcomes for patients. So an example of complementary therapies is acupuncture in cancer, oncology massage, reflexology, yoga, mindfulness, then looking at selected herbs and supplements which can be considered as complementary therapies, so that are used alongside and safely alongside other therapies. And when we talk about complementary therapies, we also look at other traditions. So in Australia, we have the Indigenous people with their bush medicine, and they are complementary therapies that are taken alongside of conventional therapy, but also looking at different cultures and different traditional therapies that may complement our way of treating patients. A lot of people will use Chinese herbs, and Chinese herbs are considered both complementary therapies, but sometimes taken as alternative to other treatments. So when we talk about integrative oncology and integrative medicine and the use of complementary medicine, it's evidence-based, evidence-informed therapies alongside of other treatments that complement it. So people will ask, how do complementary therapies improve people's well-being outside of what we have to offer at the moment? And when we're looking at complementary therapies, we look at the whole person, and we look at basically having a larger toolbox to care for our patients. So we know that people from the time of diagnosis through disease-modifying treatments and into survivorship and being on surveillance with the fear of recurrence will say, what else can I do to improve my well-being outside of taking painkillers, exercising, of course, which is part of our process of care. What else can I do? And we look at what therapies and what evidence do we have to treat specific symptoms related to cancer, but also that work alongside of the other treatments to perhaps improve outcomes. The principles of integrative oncology, which is integrative medicine specific for cancer patients, is really to empower people to take care of their own well-being. So when we talk about integrative oncology, we're talking about how do you improve your well-being by changing your lifestyle. Not everybody has lived the best possible lifestyle. I know some people will say, how did I get cancer? I've eaten well, I'm fit, I'm healthy. But for other people and for some people, there are changes that they can make that can really improve their outcomes. So maybe looking at diet and looking at what diet do we recommend, what vegetables do you eat, do you cut out sugars, do you reduce milk products, eat less red meat, eat less preservative-containing food. So that's very much part of integrative oncology. Looking at other lifestyle changes, so really looking at stress, at sleep disturbances, how you can improve your sleep, you can improve your fatigue, which is incredibly common for people during and after a cancer diagnosis. So what can you do within your just by adapting the way you live and the way you and your lifestyle to improve your outcomes. And that's very integral to integrative oncology. The other thing that is integral is looking outside of the box of what else I can do to reduce my recurrence and empower me to take control of my life. So looking at regular exercise and personalised exercise prescription, looking at stresses that are in your life or environmental stresses that you really need to say, wow, I don't need that anymore in my life. How do I change the way I live? Mind-body practices, so yoga, qigong or tai chi, and mindfulness or meditation are really integral to have some sort of strategy in place that enables you to reduce stress and cope with living with the uncertainty of a diagnosis. And this is really the strength of integrative therapies as part of that holistic supportive care, that they're really there to give you skills and empower people to actually have a positive life with cancer. So the most common reason that we often see people, and we're situated within a hospital, so people will come and see us often before their scans, or often a lot of people get very anxious after they've had their scans and they're waiting to see the oncologist or the urologist for the results. There's the huge anxiety, oh my God, what if this disease has come back? How can I cope with the waiting, the uncertainty, the what ifs? And so a lot of our focus is on giving people the tools to be able to cope during that stage, but also actually physically supporting people during those periods. So we know that touch therapies such as massage, as reflexology, can really help people just feel calmer and at peace and sleep better. And so often people will know that between their scan and seeing their oncologist, they may have a day, and we say, well, why don't you book in for a massage on that day? Why don't you book in for a treatment on that day? It's okay. Well, it's going to be a hard day. Let's work on that. The other skill that's really helpful is, again, the mind-body therapy. So imagine if you have the skills of understanding how to practice mindfulness meditation. And mindfulness meditation allows those thoughts, those difficult thoughts of what ifs, how am I going to cope if, all the noise that may be in your head, and being able to sit with that and enable it to be respected but pass through, so you can be in a peaceful space. So, for example, we run online mindfulness programs to assist people to have some of those skills so they can use those skills in that period where they're waiting for their 3 monthly scans. And that's a very cheap and effective technique of empowering people to cope and to feel that they can get through that difficult period of anxiety and uncertainty. Obviously, seeing a psychologist if these thoughts aren't going away is really important, and psycho-oncology is a really important part of the holistic care of a person. And so it's looking at what best suits the person. So if I see somebody, it's what best suits this person throughout their cancer treatment. So everybody's having different cancer treatments. I have a patient, the patient who's having regular cystoscopies and knows after or regular BCG and knows for a period after that time they really do not feel great. The anxiety before the therapy and the stress after the therapy, and working out a program of care that can best support that person all the way through. That includes maybe regular yoga, the right pain relief at the right time, the selected use of herbs and supplements to best support well-being and health, and the use of acupuncture and other treatments that may reduce some of the symptoms, and timing it and preempting. And that's really our focus, is that preemptive, proactive approach to wellness. And it's not just us. I mean, this is happening throughout cancer hospitals around Australia and around the world. This is the new way of caring for people with cancer. So people will often ask, well, what's the evidence to suggest some of the therapies that we recommend? And this is a really interesting space. So the Society of Integrative Oncology, which is a global organisation, is really the primary focus is to provide the information that provides the evidence to support certain therapies that may improve symptom management and well-being for patients with cancer.